I'm pleased to welcome you all to this concluding session in our sustainability series, which is focused on the long-term sustainability of our systems, services and collections. For this final session, we will hear a perspective from the National Health Service. And therefore would like to offer a warm welcome to Dr. Steve Baguley, Chief Clinical Digital Officer at NHS Grampian and former clinical advisor to the Scottish Government, who will share his insights onto the challenges and opportunities of digitalisation in healthcare and describe the environmental, economic and social dimensions of sustainability, as well as the impact of AI on the future of healthcare records and pathways. So without further ado, I would like to hand over to Steve for the presentation.
Okay, thanks very much. So I'd like to say a bit about my situation in Grampian. So I'm a Chief Clinical Digital Officer, and in that role, I chair the Health Records Group for NHS Grampian, and our directorate, the Digital Directorate, also looks after the libraries for NHS Grampian. So quite relevant for research librarians. And as a sideline, I'm also chair of our community's climate action group in Udney in Aberdeenshire, and I also chair the local paths group, which has a connection with active transport and low carbon travel between the villages in the area. So what I'm going to be covering is the future about the digitalization of healthcare, but it's worth going backwards to start with to think about where healthcare was a couple of decades ago. There's a possible scene from the 90s here. And in the past, we can think about clinical assessments, so a clinician with a patient, and generally the person had a problem. I mean, we have clearly been doing prevention for a long time, vaccine screening and so on, but typically the person has a problem, and contacts were done in person. Usually a patient would go to a clinic, community area or hospital, and have a consultation with the clinician. And it'd be done real time. There's not really much of an asynchronous messaging type of setup in the 90s for healthcare. And any notes would generally be on paper. I mean, there were some early record systems for keeping track of IDs, patient IDs, numbers, and so on. But generally, actual clinical notes were all on paper. Prescriptions, observations, again, all on paper. And if you wanted to get support with a decision, you weren't quite sure what was going on in terms of managing the particular case you've got in front of you, then you'd go to a library and look it up, and then became CD-ROMs and things like that. So that was the past. Now, what's the present? Well, in the present, fairly similar, but definitely some changes have occurred since the 90s and noughties. Generally, still the person has a problem. They're coming to you. We're not going upstream too much, but we're still doing the vaccinations and screenings. But increasingly, the contacts are done remotely. Many people have had phone or video consultations now. That took a big step up during the pandemic, of course, and has slipped back to an extent, but it's still much more common than it was, say, 10, 15 years ago. And increasingly, those contacts are asynchronous. So someone sends a message, someone gets a response, maybe a GP type of e-consult exercise and so on. And lots of remote pathways now, remote care pathways for chronic diseases include features of this asynchrony. Notes, prescriptions, observations are now mainly electronic. Across the UK, they're mainly electronic, but definitely not complete. I mean, probably 30 to 40% of records, I would say, across the UK are still made on paper. Clinical decision support, people don't have to go to a library anymore, but generally the guidance is via a sort of curated online guideline. You go and look up if you're not quite sure how to manage or where to refer someone who's peeing blood, for example. Where do you send them to? You go and look it up in a guideline. That's typically how that works. But in terms of where we're going, where the future lies for healthcare, then current trends suggest it's something like this. So there's big emphasis on going upstream, moving much more into prevention to try and reduce chronic disease developing in people's middle age. And so that will increasingly become the focus of the NHS. Now, the NHS probably won't do this alone, do it with its partners, but healthcare more broadly will, I think, perhaps be more accurately representing the word health, so wellness maintenance rather than the disease service that mainly it's been. That is at least the political ambition, for it to be like that. And increasingly, the ascertainment of a person's condition will be done remotely rather than via face-to-face consultations. But clearly, some of that will continue to happen. And much of this, increasing amounts, will be done asynchronously via sort of messaging, getting advice, and so on. But clearly, there will still be appointments, and people will be having surgery, and some of that will be robotic assisted, but most will be by humans. Notes, prescriptions, observations, all that stuff, that will be essentially entirely electronic before too long. And clinical decision support will move from being somewhere you go to look stuff up, to a website where you find things out, to what will become sort of guardrails within your electronic record system, giving you guidance and suggestions of what to do. And do you really want to do that thing you're about to do? Have you thought about doing this instead? This drug's safer, that one's cheaper, those sorts of things, which are already starting to come in, but far from universal at the moment. So those elements of human rules derived or machine learnt rules will become ever more common. So in terms of some of the language I'm using here, now I've called this talk digitalisation intentionally, and it may seem a bit pedantic, but the words digitization and digitalisation are given different meanings in the context of changes in healthcare and other areas. Broadly speaking, digitization is just changing something to be electronic but keeping the same format. You might have gone from a sort of free text note, paper note in your record system, and now you have a free text box and an electronic record system. So you've gone from a paper sheet to an electronic sheet. That's basically digitization. Digitalization is where you do something different because of the capabilities brought by doing things in an electronic form. You start to redesign the care system. So it might be, for example, that now you have an electronic record that someone's ill at home, for example, they can still do a bit of work, or a patient can connect remotely via video, and you can maybe have a three-way conversation between the patient, their carer, and the clinician. All sorts of things become possible when you have a digital elements to a care pathway. And a lot of the limitations are our imagination in terms of what we could do when thinking about some of these opportunities. So sustainability, that's what the theme of this talk series is about. And sustainability is quite a broad range of topics. And I've decided to split this talk into three domains of sustainability: environmental, economic, and social. And you can see from the breakdown here that each of them can be further broken down into numerous sort of subheadings. But what I'm going to do is go through each of these three areas, talk about the relevance for healthcare more broadly, and then think about almost like a weighing up the sort of the balance, the scales of the situation where we have a sort of largely paper analog healthcare system versus where we have a pretty digital healthcare system, and what's the conclusion? Is it more sustainable to have a sort of paper-based analog healthcare system, or is it more sustainable to have a digital care system? So let's go through these various dimensions and see what we think. Right. So environmental sustainability. Now, all health boards in Scotland, and I'm pretty sure it's the same for trusts in England, need to assess their sustainability when it comes to climate impact. And this is an example of NHS Grampian scores against the sustainability assessment tool from a couple of years ago. And as you can see, this is tracked against many domains around this radar plot and tracked over time to see how this goes. And then I've seen the questionnaire, many hundreds of questions covering all of these domains, which are filled in each year. And there's a report done for Scotland, and I'm sure, again, it's done the same for England, Wales as well. There's an annual report issued on the sustainability of the healthcare system. And I was mentioning to William last week that sometimes health boards can even get charged sort of fines for certain aspects of this. And the particular way that happens is that a health organisation may generate electricity on site. So we have a gas turbine here in Aberdeen that's used for some of our sites, and then we have to pay emissions related fees for using that. So the impact of carbon pricing and emissions trading can affect health organisations directly. But what's interesting, if you look at this radar plot, is there are multiple areas around that. None of them are. There's no thing there for digital as a thing that can be pulled out to say, right, well, that is our digital sustainability or the amount of carbon generated through our use of IT. And nor is there specifically one on health records. There are multiple things which are relevant to health records and digitalisation. I mentioned transport before, so there's one there for active travel and transport. There's other ones around the environment and waste management and so on. But we don't really have a score that can tell us objectively whether digitalising healthcare and records in particular, whether that is more or less sustainable as we move through time. So that's a bit of a caveat, I guess, I'm giving you to think about. So having said that it's hard to get an objective measure for how our environmental sustainability stacks up in the healthcare system, we can have some thoughts about what the balance might look like. So, for example, for paper records, then we know that there are some advantages in terms of sustainability. I mean, paper, we can grow paper in the UK, grow wood quite easily and make it into paper quite easily in the UK. We do obviously import wood and paper as well, but we could have it all locally grown. There's no e-waste. There's no requirement to mine things in DRC or to risk chucking things in a landfill site full of potentially toxic metals. And storing paper records uses little energy. I mean, it doesn't go off if you keep it there. Clearly, there are some costs in terms of the building you've got it in, but you don't. It doesn't need to be stored, charged like a spinning disk drive might, for example. On the other hand, there are some advantages of digital records as well when it comes to environmental sustainability. One factor is you need much less storage space. One of the biggest costs in terms of environmental impact for health organizations is storing things, storing records. We still have lots of record stores, all require climate control and including heating and the very fabric, the embedded carbon within a building is massive and more significant than many other measures in some case. So if you don't need as much space, as many buildings, then that is a good thing when it comes to environmental sustainability. You don't have to move digital records around in a meaningful way. You don't have to have trucks taking them off to peripheral clinics, which is a benefit as well. You don't have to, if you want some records to look at, you don't have to ask someone to go and get them for you, or a chain of people to bring them to your department to review. Doesn't contribute to deforestation, at least not directly. We're not making computers out of wood yet. And importantly, although many people are aware that data centers consume vast quantities of electricity, some cases the size of small countries, increasingly the grid is becoming decarbonized in many parts of the world, particularly in the UK. And this is some data just from last night from Carbon Intensity, which is a great website you can go look at, showing live data on the carbon intensity of electricity generation in the UK. And you see that big differences across the country, but Scotland has effectively decarbonized the grid most of the year, not all the year, but most of the time it is pretty decarbonized. So the climate impact of having a data center running in Inverness is near zero from an electricity perspective. That's not to say there aren't other impacts. So moving on to economic sustainability, it won't have escaped your attention that healthcare is quite expensive, and it's a very political issue, how much we spend on it and how much different parties may want to spend on it. But healthcare spending has increased significantly over the last few decades as a proportion of GDP and in absolute terms. And the projections are that this will just continue to increase. So costs are going up. And it is interesting on this report from the Health Foundation that although there is a massive real terms increase in healthcare costs, which is clearly the most important thing when it comes to how we're going to pay for it, a slightly more encouraging level is that if we look at an age-adjusted factor on the lower line there, then the increase in spend is much lower. And the reason for that difference is that people are getting older. And if you look at the cost for looking after, say, an 80-year-old, then that hasn't gone up as much as the overall cost. It's just that there are a lot more 80-year-olds, 90-year-olds than there were in the noughties and before, which is a good thing. But we still need to pay for all that somehow. So let's look at the scales then for economic sustainability, making sure that the NHS or healthcare system will be there for decades to come. How does an analogue or paper world of healthcare stack up compared to a more digital world? So looking at the paper side of the scales, well, it's very cheap to start up a paper record system. And when we were digitizing records, I mean, we're still doing it, but when we were making big steps into digitizing records sort of 10 years ago, then loads of departments could just start recording things on paper, and we'd find different services just starting their own records, and dead easy to do. Get some files, get some paper, just start making your records. And because of the transport problem, and maybe you couldn't get the records in time, it led to dozens of different record categories used in multiple different places. So they're very cheap to establish, to start using a paper record system. You don't need to pay software licenses, which is a huge amount of cost. And you don't need a network infrastructure and all these sorts of things for paper records. And you can employ people locally. So if you're worried about local unemployment, then you can get people in to give them jobs managing your paper records, filing things, carrying them around, all sorts of local job opportunities with paper records, which support the local economy. Advantages of digital records: we don't need as many people to manage digital records as you do paper records. And that is a benefit when it comes to total cost, maybe not such a benefit if it comes to employing people locally in your community. There's benefits for more efficient workflow. So a bit of data that helps determine the best course of action is available remotely to somebody to come up with an answer much quicker than it might be if it was on paper and they had to send for the file. There are lower storage costs if you take into account the cost of the buildings needed for keeping paper records in. Not to say storing electronic data is free, of course. I mean, there are costs to that, but it's overall cheaper than storing paper records. There are fewer medical errors. There's pretty good evidence that if you've got electronic documentation of someone's healthcare, then because it's better documented, more legible, more accessible, fewer mistakes are made. And mistakes cost the NHS and other healthcare organizations lots of money in terms of litigation. So that's an important factor. It's also easier to identify cost savings, and we're not really haven't really moved into this area in a huge way in the NHS yet, but process mining will become increasingly possible the more digital our systems become, able to identify where particular parts of the process could be optimized, gaining efficiencies, speeding things up, leading to improvements in care quality. So that's another benefit of the digital side of the scales. And then finally, got social sustainability. So social sustainability is really around making sure that people who need the NHS are able to be served by it, and that the staff who work in the NHS are able to do their job to the best of their ability. And this is an interesting area that perhaps doesn't get considered as much in terms of sustainability as climate sustainability, but it's hugely important. And so here's some data from England showing that many of you won't be at all surprised to know that if you are more deprived, the chances are then you may die younger than if you're least deprived. And some of that is because of access to healthcare services. A lot of it is due to other determinants of health, but some of that is definitely due to limited access to screening services, early intervention, primary and secondary prevention, and treatment. Looked at another way, so this is some data from Scotland, looking at pediatric dental extractions. So this is from the Atlas of Variation, which is a fascinating website. If you look for Atlas of Variation, you'll find all sorts of data you can drill around into. So this is one on, as I say, tooth extractions in children, showing that the most deprived children from the most deprived families are far more likely to have tooth extractions in hospital than the least deprived ones. An indicator not of what a brilliant high capacity service we have for removing children's teeth, but an indicator of their poor prevention that is able to be provided to children in more deprived areas for various reasons. So definitely some issues here in terms of sustainability, in terms of equal access to healthcare. But what's the relevance of digitalisation for this in terms of paper versus a shift to digital ways of doing things in healthcare? Well, so if you've got the paper record side of the scales here, so there's a very low technical barrier. You know, if somebody has a paper record and they've maybe done if they're a member of the public and they've done a subject access request, or back in the day for a pregnant woman with handheld notes, you can look through them pretty easy, as long as you can read English or the language of the country that you're living in, then there's not really a technical barrier to be able to understand what's there, assuming you can read the writing and understand the jargon. People are very familiar with paper records, whether you're a member of staff or patient. The idea of flicking through paper is pretty intuitive. You don't need a user guide to be able to do that. And gives local employment as well. So it could be that those people employed by the NHS, and the NHS is often a major employer in local areas. I made this point on the economic stack as well, but I think it's all equally relevant here that many sort of entry-level jobs in sort of records management, portering, and so on can be available to people and support both the local economy, but the sustainability of the NHS in that community. And there's also a certain level of trust with paper. People can see it, they know where it is, they know there's not being hacked by somebody from another country at that moment. So there's a certain trust there. We don't really get people complaining about paper records and their security. Perhaps we probably should, but we don't really get people complaining about that as much as we do complaining about the digital records. So advantages of digital records in terms of social sustainability, well, there's much better continuity of care. We know that going back to children and their teeth, we know that some of the most vulnerable children move around or are moved around the country a lot, sometimes fall out of care, don't get the assessments and support that they need. And with electronic records, it's much easier to join that up, so people are less likely to fall through the cracks and not get the care and support they need. Much better continuity of through a life course from antenatal, neonatal, childhood, adulthood, and so on. Joined up care between primary care and the hospital system, and potentially with third sector and social care. There's less access to less need to travel, and we know from the equality impact assessments that have been done for video consulting that although people have thought that video consulting would be difficult for people to do and maybe create an obvious digital divide, actually a lot of people in lower socioeconomic groups had phones and had data and were delighted they didn't have to travel to a hospital appointment. It saved them money, saved them time, and that was a great benefit. So we mustn't assume that digital creates inequality. In some cases, but not all cases, in some cases, it can actually level the playing field when it comes to accessing healthcare. It's also easier to access your own records through digital systems. We don't yet in Scotland have as good a system as happens in other parts, some other parts of the world. Kaiser Permanente in the US, the NHS app in England are both ways for people to be able to access their data. Williams in Switzerland. Switzerland has a brilliant vaccine system. You may want to talk to people about that. So anyone can see all the vaccines they've had, and people can contribute from all sorts of places. Way better than an approach on where you've got a paper vaccine card that you carry around with you and try not to lose in your shoebox under your bed. And importantly, also with electronic records and digitalization, the data can then be used to identify areas of inequality and to support people's healthcare better. And we move into areas of population health management, moving upstream to support people better than was previously possible. So in conclusion, if we have a question, which is more sustainable, paper or digital, then there isn't really a simple answer. It depends. So in one scenario, we digitalize through burning coal to generate electricity to power our data centers, and we make systems which are inaccessible to members of the public and which are very expensive, draining the NHS and the state for resources. On the other hand, we use green electricity to power our data centers, so limiting the carbon impact, recycling any materials, any e-waste that emerges as a consequence of our use of digital technology. Maybe we make sure we expose all the data that we have to the public and train and support people in doing so. And community libraries, I know different from research libraries, but community libraries are seen as a place to support members of the public with digital learning to be able to access record systems. And in places like Estonia have been leaders for many years in making sure all the citizens can access the data they need about their health in terms of their record systems. So those scales, over to you. What do you think? Do you think that on balance, we're getting it right in the UK and that digitalizing is more sustainable than the 1990s and the noughties way of doing things? Or are we going down into a dark cavern of unsustainability, which we'll all regret? Look forward to getting your thoughts.
That's really great. And thank you, Steve, for leaving us with that thought-provoking question. I will turn my camera on in a second. If I can work digital technologies, maybe some of this, the challenges is how we interact with that. So that's been really great. And we have got a couple of questions that are coming through in the chat. But I did have something that I was thinking about in terms of that, which way do we go in terms of digitalisation? And I really liked the three dimensions that you presented there in terms of thinking about the environmental, thinking about the economic, and the social as well. And I don't think I hadn't come across that social element in any of our decision making in libraries. I might just be speaking from my own perspective, but that was something that was new to me. But I was wondering, in terms of if you see that as a decision making matrix for weighing up whether we should go analog or whether we should go digital, is that something that you are doing in the NHS in terms of using those three dimensions? And also, if you are the all equitable, or do you have one which is the primary focus for you?
Well, I mean, I perhaps won't surprise you to know that overwhelmingly the driver is money, and we get a lot of encouragement, should I say, locally, to do things at lower cost, but not drop the quality. And that's important to say. It's not about doing things worse and cheaper. It's about doing things as good as we are or better and cheaper. And I know that is the position for the UK as a whole to try and do that. There are loud voices about the other two areas, the climate and the social aspects. I think the social aspect is largely around digital inequality as we digitalize healthcare, and those voices are definitely heard and considered. It was at the Health Board Digital Leads meeting this morning for Scotland, and we're talking about citizen facing digital services, and it's people are all over that issue of the risk of digital inequality, how we prevent people falling into lack of care because of the system we're introducing. So definitely the money has a thing. The social is definitely something which is spoken about. Climate, I think it definitely could be feature more. It doesn't feature as much in discussions as you might imagine it should at the moment. And although all the health boards do have that assessment, as it pointed out in the radar plot, there's not really a specific thing you can point to which is exclusively relevant to digitalization of healthcare to say that's the score. We have digital maturity assessments each year, for example, and but there's not really a huge amount in there in terms of the carbon impact of what you're doing, which is I think quite an interesting situation, which probably needs to change.
Yeah, because you were saying actually when you got your graph up, there wasn't something that neatly said digital in there. So in terms of that focus in the discussion, it cross sections into a number of those different dimensions when you're reporting in terms of the carbon footprint, but not there. So maybe some of that's why it's not as
Yeah, I
focused.
mean, we this came up a couple of years ago. We were trying to get business case through for changing from paper letters to patients to digital letters. People could just go on and access all their letters, which is becoming increasingly common across the UK now. And I was saying, could we use the scoring system as a way to argue for that investment? But there wasn't a way of recording that shift, that digital shift in the scoring system to give us an argument to support the business case.
Yeah. Thank you. I have taken chair's privilege with my question there, so I will move on to some of the ones that we've got in the chat. So we have got one from one of our colleagues who's joining us from NHS Libraries, I'm assuming from the question that we've got here. And they've mentioned that they would love to see improvements in digital repositories from pathway documentation, research data, research outputs, and community papers. So they were wondering whether this is an area that you can speak to from your experience and the scope of your role.
Well, I mean, to a certain extent, Tim, I know Tim because we're both from the North of Scotland AI implementation group. And I mean, there are already some repositories for some of the things you described. I mean, there's There's a kind of national IG repository for certain papers there. I'm going to say national, meaning Scotland. There's not very much at UK level. Many of the other ones depends on the situation. Committee papers. There's a kind of a hub for the various sort of national meetings that happen. I'm involved in. There's multiple. There's a kind of M365 hub there people can go to for those. Could it be better? Yes, definitely. And there's a lot of reinvention happens because people can't go to a library and pull something off that to satisfy the need, and therefore they start again with a DPIA or an SOP or another acronym for the thing they need. So yeah, it could definitely be improved.
Okay, we've got another question, which is also talking about that development and improvement as well. So we've got something from Morag here, who's asking about that sort of maybe that lag that we have in Scotland in terms of some of the patient access, making appointments, and some of the digital notes, and are the factors that are specific to us in Scotland or maybe in North East Scotland that are different maybe to the rest of the UK? Because you mentioned in terms of the NHS England app as part of your talk, and us not having something similar.
Yes, I mean, it's been a political priority for many years. I mean, 2017, a cabinet secretary at the time said by 2020, all citizens will have access to their records, and 2020 came and went and nothing happened. I think generally, I mean, a simple answer is we have the system that people wanted. And at the time, the government didn't put the money into creating such a system. And maybe some of that is political, not wanting to just kind of copy what England had done. Clearly, we have a different patient numbering system in Scotland than England, so it wouldn't easily be a lift and shift exercise, but perhaps could have been done. And maybe in retrospect, that would have been a much easier route than we've taken. We do have what's been called informally the digital front door launching in December, which seems like a pretty confident date. That's going to start giving people access to appointments and some of the correspondence. They're starting in NHS Lanarkshire in December. So the toe is in the door of that. And other areas, so maternity services of pregnant women, if any of you on the call, for a year or two now, I've had access to maternity records, citizen-facing maternity records, replacing the paper handheld records. So that's been pretty popular and quite widely used. So it does happen, but not definitely not as comprehensive as it should have been by now, because I think it would have saved a lot of cost as well. If people can access their records directly, then they wouldn't need to be making subject access requests for people then to rummage around assembling all the documents for people to send out to somebody.
Yeah, actually, on that kind of, you mentioned there in terms of maybe a bit of fragmentation in the different systems that we use across the UK in terms of that. And it's not a question, but it's a comment that someone's made in terms of are the challenges that are presented with the transfer of digital records between these systems and organisations, does that cause an issue and maybe cause a barrier to implementing some of those digital workflows?
Definitely, yes. I mean, if you move GPs, then the say you move from Aberdeen to Manchester, let's say, then the records can be transferred, but there's a bit of a delay, and it's like the whole thing is summarized into a massive PDF, and off it goes to the new practice. It's not necessarily as structured data which you can analyze as well. And then other systems, I say if you transfer your specialist hospital care from one place to another, there's not really a way of transferring that information from, say, Aberdeen to Manchester or vice versa, other than emailing maybe clinical letters and so on. So that huge problems emerge from that in terms of continuity of care. There is a bit of a tension here. So there's the kind of once for Scotland, once for the UK type of model, the idea of having one record for the entirety of the UK. And people don't really talk about it much for the UK, but certainly in a England versus or a Scottish level, there's talk about that. Once for Scotland record systems has been a solution. but you always get an edge to any record system, and then you need to move stuff to another system for other people to pick up. So it is a problem. I think though one way to reconcile that is to have a central store of core documents, like discharge summaries, for example, clinic letters, drugs, allergies. Very similar to the parts of the kind of spine in England, or the emergency care summary in Scotland. That sort of core bit of data, and the narrative detail of so and so woke up, had a good night's sleep, doesn't need to be accessible to everybody, but the really useful things could, I think, be in a central store, accessible to support for that care. I can see how that could happen. And of course, increasingly, we're already using generative AI for various purposes, and increasingly, I'm imagining you could have a live summary. So you go into patients' records, and it sort of pulls down summaries of various sources available to the record system and summarizes the person's care to you with access to the original data to verify it. But I think that will probably help quite a lot to get an idea of the myriad data sources and to present them in a sort of a nice rounded summary of that person and their care.
Yeah, having that single source of truth that's got some of those key bits of information.
Yes.
Thank you. I don't think we've got any other questions, but there was one more that I did want to ask, if I may. So, towards the beginning of your talk, you mentioned something about the limitations of digitalisation being our own imagination. So, with that in mind, I did just wonder if you've got any, like, of those future thoughts of where sort of digitalisation is going to go and digital sustainability within the NHS.
Yeah, so I think I wouldn't even limit it to within the NHS. I mean, I think ideally we need to enable members of the public to do as much of their own wellness maintenance and healthcare as possible. So we talk about clinical decision support, and in my examples there, and going to the libraries, looking things up in guidelines. But increasingly, it'll be possible to for a member of the public to be given trusted information for their particular problem. The let's call it the NHS app. We'll know all about their results, their conditions, give them tailored advice, connected to various centres if they want around their home, giving various suggestions on things to do in terms of, the pollen count's high, you need to do this and that. So increasingly, I think it'd be a less sort of parentalistic, as I like to call it, healthcare system, empowering individuals to keep themselves well, and it'd be an expectation of the state that people will keep themselves well, and that'll be enabled through a less obesogenic environment. So it'll be be harder for people to become overweight and develop chronic diseases early because of the good legislation controls which we're hearing about coming in. That'll only increase. So I think that's the only way that ultimately the NHS, I think, can be sustained in a broader sense, is through the adoption of more technology in the citizen-facing space, and the enhancement of productivity on the staff side. If you think of where those lines are going in terms of cost, unfortunately, GDP, if we're supposed to be spending a lot more on defence as well, then where's the money going to come from? So unless we enable more DIY, as you might summarize it, through digital, then it's hard to see where we're going. And I really think that'll happen. And I think it's generally a pretty good future, as long as there's a safety net. It can't be just do it yourself, don't bother us. It's got to be, we will give you the tools and help you to understand the tools of how to keep yourself well and manage any conditions you may have. But we will be here still if you have any problems. And I think it's important that both those things happen. And it's a bit of a tightrope to walk that.
No, well, thank you. But I think that's a really uplifting message for us to leave on, in terms of that, how digital technologies can empower us all, as long as we've got those guide rails and safety nets there, that if we can't use them, or if we need to speak to a human, we can still do that as well. So that kind of prevention over cure seems like a really great way for us to finish on.